Hi, everyone, and welcome to Take a Pause with Menopause, where we will talk about the pause in all of her glory and not so glory. But we will bring real conversations which are honest, real, and, well, sometimes funny. I mean, you have to find some humor with what's happening with us, right? At some point.
Very true.
Yeah. So I'm happy to have my partner in menopause, Raquel, on with us. Raquel. And today we are so happy to have Dr. Laura Dalton, who is the Chief Medical Operating Officer of Planned Parenthood in Marmonte. And allow the Jersey to just take over that word. We'll have Laura explain where that is and what that is, but we are so glad to have you here. So, welcome.
Thank you. It's great to be with you both today.
Thank you.
Thank you, Laura.
Yep. And how we always like to start is we like to give everybody just the opportunity to explain like their journey, where they've gone, how they got here. So we would love to hear about you and your story and what you've been doing.
Great. Thank you. Well, I sort of think of my journey as two paths in parallel. So I have
Oh,
a kind of deeply personal story. So I was in my early 40s and starting to feel all the symptoms of perimenopause. And it's like, okay, I think it's time to get on hormones and start feeling like myself again. And perhaps maybe I could start sleeping again. So it's kind of gearing up for that when I was diagnosed with estrogen positive breast cancer.
oh,
So no hormones for me, cannot take
all
estrogen with
right.
that type of cancer. And now I'm on tamoxifen, which is a selective estrogen modulator. So it kind of in your body, it sort of tries to tell certain tissues, block the estrogen, and it tells other tissues it's okay. But really it just exacerbates like menopausal like symptoms. And
Oh,
so, I live in this world where I could access hormones because as a physician, I could write them for myself or, have a conversation, really advocate for myself. And
Mhm.
knowing that I wanted to do that, always wanted to be on hormones when I started to have symptoms. And now I'm in this
yeah.
position where I can't and feeling those symptoms
Yeah.
every day and not sleeping. And then also kind of going through that battle of, is it like, what's worth it? Right. Like, is it,
Mhm.
when we talk about quality of life, which I think is such like the key thing about menopause, right? Is quality of life.
Hmm.
Exactly.
And so, like, do I stay on the tamoxifen? Do I just take the hormones and risk it because my quality of life is bad? Do I risk a recurrence of cancer? So it's just this challenging thing, and I think just makes it just makes my awareness and thinking about patients who are struggling with accessing care or don't know what's going on. It just makes it much more personal to me. And then the other path in parallel is my professional path, and so, as the Chief Medical Operating Officer for Planned Parenthood Marmonte, we're the largest Planned Parenthood in the country. We have 30 health centers in Central and Northern California and all of Nevada. And so, I'm always paying attention what's going on in the community, what do our patients need, and really thinking about how to be innovative and responsive. And I started noticing, kind of like I said, in parallel
Hmm.
at events, all the women standing around talking about their perimenopause and menopausal symptoms. And interestingly, their inability to talk to their primary care providers about it. So
Yeah.
these
Yeah.
are women who are established in a healthcare system, have a primary care provider, often like their primary care provider, and are
Mhm.
going in with their symptoms. And the things that are being said to them are horrific, right? So maybe labs are drawn and maybe they're normal, which is happens, of course, right? And so then these providers are telling them things like, well, you're fine, but maybe you could just like eat a little better and you should probably exercise more. Have you tried meditation? And that is, I think, as a woman, we tolerate so much. And
Yeah.
when we don't feel well and we go in and we ask for help, when we make the time to do that and
Yeah.
we are not heard and not validated, I think I mean, there's not much that's worse than that.
Mhm.
And so after hearing all that, I was thinking, I have to do something for these women. They're not our target population, right? We
Yeah.
typically in our health centers care for patients who don't have insurance or who are on Medicaid. But I said, these women probably used our services when they were young, and while they don't need our traditional services anymore, we can help them. So we
Mhm.
created a kind of concierge perimenopause menopause program called
I'm so
Poppy.
excited about this. I
It's
really
I
am.
know. I know. Same.
it's amazing. So it's Poppy like the flower, the California State Flower, Poppy care.org. And the goal is to just reduce all the barriers for patients and to get that individualized treatment. And so patients can call in, speak to a clinician same day, right at that moment, or schedule an appointment and really be heard.
Mhm.
And so these things are happening in parallel. Like I feel like I'm sort of suffering and trying to figure out how to live this new life while launching this new service to help. And so that's my journey in a nutshell.
Well, first of all, thank you so much for sharing
Yes.
because that is so deeply personal, and I genuinely appreciate you sharing that because I think that will help women talk about
Mhm.
it, because I don't think that we allow ourselves to talk about things because, like you said, we walk into the doctor's office and we'll take so much, and when we don't feel good and we just finally have hit that wall where we show up and we get told things like, "Just eat less," or maybe it's depression, you're under too much stress, like, it infuriates us, and it's not that we're, like, being raging crazy because we wanna be raging and crazy, it's because we've hit a wall. So I just want to acknowledge you and appreciate you, and I appreciate that you're bringing this kind of, like, poppy care to this population because there are a lot of women that, there's people that are like realtors, for example, that don't have insurance. And so this would be absolutely something that they could, contract workers out there need some type of direction, and it's expensive. It gets really expensive.
Absolutely. And I think too that, I, it's kind of like, what do you do when you're in an established healthcare system, like an
Yeah.
HMO, right? And
Yeah.
part of our territory has a large HMO, and then you're hitting these walls. Like, where are you supposed to go? And so I think
Yeah.
also for those that don't have access to insurance or their insurance premiums are too expensive, or they have insurance, but it's just like you're in a broken system. And so
Yeah.
having the opportunity to come to us. And I think the other thing that I really like about Poppy Care is that our kind of like the main value is like trust women. And so I've seen a lot of other telehealth type menopause programs popping up, and
Yeah.
I mean, it's great, right? Access is
Oh,
great.
yeah. Yeah.
But
Yeah.
I hear a lot of things about like, subscription fees,
Yeah.
or they kind of hold your medications hostage. And so every 2 to 3
Uh,
months, you have to have another visit. And so for us in Poppy Care, we trust women. And so we tell women these are the things to look out for to let us know if you're having issues. And otherwise, we're going to give you a year's supply of hormone therapy or whatever other treatment is best for you. And you'll come tell us if there's an issue. And so I think that's also really important. Like, we don't need to um, like belittle women
Mhm.
or put up more barriers when we are all doing all the things already. Like, who has time to have an appointment every 3 months to say, I'm doing fine on my medication, please
Yeah.
refill it?
Yeah.
I know
I think,
exactly what you're talking about. Yeah.
yeah. I'm actually doing something like that because I could not get testosterone here on the East Coast. It's taboo, in case you didn't know.
Mhm.
It's bad. So I couldn't get it. So yeah, I am doing an online, and I have to pay monthly, even though and I'm doing injectable, so the vial will last 28 weeks. I'm like, "Okay, perfect. I'll see you in another 28 weeks." And they're like, "Yes, because you're gonna keep paying monthly." And I was like, what?" But there's nothing else I can do
Yeah.
because, I have had every provider that I have gone to is like, "Nope, no, we don't do that. No, we don't believe in that. No, that's not something that we do." And there's no
Yeah.
I in there. I was like, "Well,
I'm the
hello?"
patient. I'm
Yeah,
the
I'm the patient.
patient.
So it's, so that is what you end up having to do. So just the fact that you're allowing a woman to be her true own CEO, like we know when
Oh, yeah.
something's wrong,
Right.
you know, so you would have the ability to contact and be like, hey, something's wrong. I don't feel the same way that I did on my patch, or I don't feel the same way with this. And you'd be able to be your own CEO. That to me is the best part of this whole entire concept that you said with Poppy Care, because for me, I feel like I am being held hostage by paying a substantial amount monthly
Yeah.
just to be able to get my testosterone.
Well, you're already being held hostage by your body and all these changes.
Yes.
The last thing we want is to
Very
be held
true.
hostage by the healthcare
Very
system.
true.
I
Very
have
true.
raised 4 children personally, and I can tell you every single symptom. I can tell you, like, "Oh, no,
Yeah.
that's this medication's not gonna work for him because of this."
Yeah.
You know,
Yes.
you've learned a lot raising
Yes.
children and living 50 plus years.
Yeah.
So, like, if you can't by 50 plus years understand a little bit of offness in your body and kind of identify that, you need these help. You need this help. Like you need somebody that's going to pay attention and like you said, trust you. So I
Mhm.
can appreciate this in its entirety.
Yeah.
I'm curious. Are you guys seeing like patch shortages, or how are you addressing that? And I know this is kind of just like the topic now because FDA just released that box thing. But I thought I'm sitting here thinking, I'm like, how is this being addressed?
No, that's a great question. So I think the thing that's really cool about Planned Parenthood Marmonte is that we're very patient focused and we have built centralized teams over the years to really ensure that our patients have a quality experience. So
Mhm.
we get it, right? And like if you finally have this appointment with us and you feel
Mhm.
heard, you leave the appointment like a little bit lighter and you go to your pharmacy and they say your patch, that they're on
Right.
shortage. Like
Right.
that's that's completely like not what we're trying to do. So our coordinator teams monitor the pharmacies
Oh,
to see which ones have the patch on allocation. And then we let the patient know.
nice.
We ask them their preferred pharmacy and then we might say, oh, actually, CVS as an example has it in
Yeah.
stock right now. Let's do that instead of Walgreens as an example. So
Nice.
we do that work ahead for our patients. And so far, we've always been able to find a pharmacy that has patches available. And so we've been able to move around for the patient. Now, it's not ideal. In an ideal world, the patient would go to the pharmacy that they want. But I
Yeah.
think, at least us doing that extra step and helping the patient is really, really important because, I mean, can you imagine you're so close and you finally have the
Right.
prescription and then you can't get the medication? I mean, just
Yeah.
how infuriating.
Or you
It's
just
like
get
that.
started and barely evened out in your like ebb and flow of hormones, and then they're like, "Oh, sorry."
Yeah. It's
Yeah.
like that
It's
dream that you have, right? When you're like running down the hallway and you see the door you're like, "Oh my gosh, I'm at that door." And then they're like, "Nope, there's another door now because
keep
yeah,
running.
there's keep running." It brings anxiety, like it gives me, and I'm
Oh.
sure other women, anxiety in the fact I'm looking at the patches and I'm just like, "Well, can I call it in quicker?" And the answer is no. No. No,
Mm-mm.
you can't.
Mm-mm.
Not with my insurance. They're like, we will wait until you get down to 3 patches and then we'll refill it for you. Meanwhile,
Yes.
you're like sweating. Like, can anything else?
Yeah, because then you gotta rely on shipping because for me,
Mhm.
Yep.
I'm forced to use an online, like,
Same.
subscription. Yeah,
Same.
so I'm
It
like,
has to be shipped.
"Shipping? Like, where the heck" then you're tracking it after you
I
just
know.
spent 2 weeks
I
talking to
know.
some online guy that gives 0 craps about what you've got going on.
Yeah.
And you're
Yeah.
like, "Where is the patch?" They're like, "Sorry, we'll add you to a list." Like,
Yeah.
"What
I
list?
mean,
What's the
it's
list?"
it's I don't know. It's crazy. I mean, it's like back in the 80s and 90s when you were looking for that Cabbage Patch Kid. Like you had to find that
Yes.
you were go you were like, "Where do you calling friends? Do you have it?" I mean, people are calling, "Does your pharmacy have it? Do you have the patch?" It's
That's
like,
so true.
And it shouldn't be that way. I mean, I don't, because we have done this path about men, but I think it's this real issue in healthcare that I think that if men were put in this situation with critical medications that they want and need for their quality of life, like it's just when does that happen? And so I think that that's really, it's just one of those, it's another layer of the menopause piece, which is just really how women are seen in
mhm, yeah.
healthcare and really what's acceptable. Mm.
Oh,
I
yeah. Laura, don't let me get on that crooked carrot commercial because we all know that medication is like in the millions of how many pills supplied there is. Yeah,
Well,
that's
and I
never going
read
to run out.
something the other day that it's like only 5% of women are on HRT, which I think is like incredible.
Yeah.
The moment I found out, I was spinning out because once I actually figured out what the heck was wrong with me, because I had gone through like several years of not knowing and just like all these crazy like medical events, like to the point of almost dying. And like, it's like once I found that out, I was like, "Oh my gosh, I have to get these hormones." And then, you just get that little taste of relief, and it's never really exactly what you used to be, but there's enough, right? Where you
Yeah.
can get through and you
Yep.
can identify who you are going forward, but I can't imagine them just being ripped out from underneath you like, "Oh, we're out." Like,
I
how is
know.
5% of the women on this and we don't have enough? I don't understand it. It just
That's
doesn't
the
compute
scary
in my
part.
head. Yeah.
That truly is the scary part because if everybody was on there that needs to be on there, and
Mhm.
it, the shortage would be even vast. It would be huge, and the fact that there's only 5% roughly, and we're still in a shortage, to me, it's
Yeah.
like, are they getting the memo? Like, are the companies are they like creating patches? Like, I would have it, okay, we're going to work day and night. we,
Yeah.
we got to
Yeah.
get these
This is
patches.
this is our moneymaker, boys. Get to work.
Exactly.
Yeah, and my guess is that is happening. I mean, I don't have the insight on the scoop
Sure, sure.
specifically in patches, but I do work a lot with pharmaceutical companies. And my guess is like we were saying, once the black box warning came down and once all the evidence that's now available,
Hmm.
and then there's all this work, like the important work that you all are doing, and more advocacy.
Hmm.
I think
Yeah.
that the pharmaceutical companies are seeing that, and the shortage will be this blip in time, and then I think
Perfect.
yeah.
I do too. I'm excited about that. Well, so I think it's amazing that you guys kind of look around for these people at Poppy Care because
Yeah,
that's
I
almost like
do too.
concierge to me. So I'm
Mhm.
like, oh,
Hmm.
tell me more. Maybe I'm going to start going to Planned Parenthood. But
No,
I
it's
love that.
yeah.
How are your parents or your patients? How are patients receiving this? Are they excited? Have you seen people come in and like get like thrilled about it? Are they kind of like, what the heck? This is more of a, younger clinic or what are you seeing?
No, our patients who call in for Poppy Care are just, I mean, the things that I've said, like they'll say, I've slept for the first time in 10 years,
Oh,
Yeah.
or I feel so much lighter, or I finally feel heard. All the things that we
Hmm.
were talking about, are obviously very true. And the patients tell us that. And they talk a lot about how thorough our providers are. Our providers that work in Poppy Care are 100% Poppy Care. They're sitting there waiting for you to call. And so they have a
nice.
lot of time to dedicate. This isn't that rushed in and out with a provider who's like, yeah, yeah, okay, fine. It's really going through all of the symptoms and then really asking the patient, like, what is important to you? Like, what not just, okay, you have this symptom, I'm gonna give you this medicine, but
Hmm.
how do you want to feel? Which things are causing you problems? And so I think that patients really talk about that kind of like personalized experience with it. And then for our patients in the health centers, kind of some more of our traditional patients, we've always provided menopausal care to those patients. I think now there's just more emphasis, like enhanced training
Mhm.
to our
Hmm.
providers. People are more aware. But I think really, when I think about sexual and reproductive health, right? Like that's how I reference the services at Planned Parenthood. Provides like to me menopause is part of reproductive health, right?
Yeah.
Yeah.
It's your whole and we're really at Planned Parenthood, we're really experts at it, right? Like we have helped women prevent getting pregnant
Mhm.
using hormones. We assess hormones when there's abnormal bleeding or there's no
Hmm.
period.
Yeah.
We help women in their initial stages of infertility workup, right? And so then as your hormones start to decline in perimenopause and then through menopause, like it's like a very natural state because we're really experts at
Right.
helping women with hormones. So, yeah, I think I patients seem to be very much like, well, of course, like,
Yeah.
Yeah.
yes.
In
And
my mind, it made sense. It was such a transitionary phase, right? Like, because I went to Planned Parenthood as a kid, like in my, teens. Like, that's where I went because I just, I didn't really want to establish in my head at the time at 16, 17. I was like, oh, I don't want to go to an OBGYN. I'm not getting pregnant. So to me, it was Planned Parenthood. That was option B. And that's just where I went. And so uh, I saw it as when I heard about Poppy Care, I was like, "Oh my god, that's brilliant!" Because why wouldn't you guys talk about hormones and
Hmm.
reproductive health and menopause? Because that's the space you have lived in for the last
Yeah.
however many years.
I think
When
it's
did
really
Poppy
pretty.
Care come out?
When did it come out? We
Yeah.
started it in early November. Our website
Oh, so
just
it's
went
new.
live a few weeks ago. But we did
Awesome.
very, very soft launch because we're utilizing new technology. So
Yeah.
it's really nice that you can call and you call into a dedicated line so that the people who answer the phone, it's not just a general call center. So it's people who have more experience in menopausal care.
Oh, nice.
And then
Yeah.
you get asked, like, do you want our clinicians available right now? Like, do you want to talk to her, or him right now? And then you get transferred, or you can get schedule an appointment.
Yeah.
And then we send over consents and forms over the phone. So you can just,
Mhm.
it's your phone, you can just sign it, all the things you need to look out for. And then we send, you pay over the phone too. So we just send that
Nice.
electronically and then you pay. So it's really nice. And
Perfect.
yeah, and then we're working
Yeah.
on asynchronous. I'm hoping in the next month or 2, but to me, that's the ideal dream, right? Like, I don't wanna talk to anyone on the phone, honestly. So, like, at 2 a.m., you go on, you answer your questions in the app, and then the
Mhm.
next morning, one of the clinicians or providers will review your questions, make sure everything's good, and then they'll just send your prescription in. I
Oh,
mean,
nice.
it's just amazing. And then but if you wanna talk to the provider, like
Right.
because that's very important for a lot of people, that's still an option. But if
Mhm.
you're like me and you're like, "Nope, I just wanna take care of this at 2 a.m. when I can't sleep," then
Yeah.
I was
Yeah.
just gonna
you
say when
can
you
do that
can't sleep,
too.
that's
Yep.
the best time because you're like, "F this, I'm gonna do this, this, and this."
Yeah. Well, you forget about it too. Like, with a busy day, like I'm sure you're
Yes.
busy, it's you get home, you like eat dinner. It's like, oh, I got to hurry up and get into bed because I have to
Uh,
get up and do it all over again. And
I
it's
have
like,
my
oh,
regiment.
I forgot to call the office. Now they're closed. Now you have to wait. But no, with you, you just get
Yeah.
on there and it's all on there. Just it's the easiest thing to do. I just
I think
love
it's
that whole
brilliant.
concept.
I'm literally looking at my to-do list, and at the top it says call insurance for patches. And that has a line down for every single day because I have not gotten to it.
Oh
And it's
my
either
god.
brain fog that I completely forget or just too busy that I completely forget. So
Yeah.
that is so brilliant. I think that is
Yeah.
absolutely amazing for people going into the puppy care.
Wait,
And is it through all states, like
Oh,
all the
good
states, or
question.
is there?
great question. Right now, we're just California, Nevada. We're
Mm.
waiting to see as we've been getting, more and more media attention and it's starting to grow and we're starting to advertise more, which states kind of pop up as interest. And then we will just
Pennsylvania. Oh, I'm sorry. Did I
yes,
s
we can do that.
I
I
didn't
know.
I didn't know if you were looking for I was like, Pennsylvania,
Pennsylvania.
Pennsylvania.
We could do that. Yes, our providers just get licensed in the states where we have
Mhm.
interest, and then we'll be able to prescribe and see patients in those states.
That's amazing. I genuinely am so excited. I actually, in fact, started telling friends about this in Florida. I'm like, so, anyways, have you heard about Poppy Care? Because she was saying, I don't have insurance right now, and I've got this going on and that going on. I'm like, girl, look it up.
Mhm.
Yeah.
I mean, I
Yeah.
didn't realize that it was only California and Nevada at the time, but I'm gonna let her know that it's only California and Nevada now.
Well, spread it. She can spread it to all her friends in Florida, and then we'll expand.
Yeah,
Yeah.
that's just true. That would be great.
Yeah, they should have you should have a number, Laura, with people calling in to say what states. Be like, "Hey,
Yes.
we would really like," and, I'll get on there and I'll be like, numerous calls. They'll be like, "Oh, that Pennsylvania woman was on
Right.
again saying Pennsylvania. We now recognize her voice." It's voice detection.
That's
Pennsylvania.
great. I know. I mean, well, my dream is like this should be for everybody, right? And so
Yeah.
I think, we're just getting started with it and it's going well, and now we can start expanding. And so why not have every state, right?
I
And I
think that'd
think
be incredible.
yeah.
Yeah.
And I think to your point about being busy too is I think trying to make time to go to the doctor's office or even for a
Yes.
telehealth, like with a different company is hard, right? Like they're like you have to
Mhm.
join 15 to 30 minutes before and then you have
Yep.
to wait for them because they're running late. And so just like having that
Yeah.
chunk of time is so hard. And so my dream was really you're a busy person you finally look at your to-do list or you remember and you're like, "Oh, I have 10 minutes right now. I'm just gonna
Yeah.
call." And then there's a provider for you. Like that's the dream is like seize the moment of when you have that and not having to carve out such a huge chunk of your day.
I
Oh, I
think
love
that
that.
and the fact that then every woman who is doing that also feels seen and, validated that, like, yes, you have a problem. We will get help for you. And they get the call and they're like, the relief. They just feel like somebody listened to me and listened to what I'm telling them. Like, because, like you had said in the beginning, I have also gone in, you go into the doctors and, I was said that like I'm always achy or whatever, and it's always stress. And I'm like, no, my body hurts when I wake up. Like, how does it hurt? I slept sort of, and
Yeah.
but I think it's great in the sense that you get off the phone and you're like, oh my gosh, okay, I know
Yeah.
help is on the way. Like that to me is what the best takeaway would be for women after they get off the phone.
And that you're not crazy.
Thank you.
I g- I have a I gave a talk this last weekend about women's health, and part of it was on menopause. And like that is one slide that I have. It's like, no, you're not crazy. Because I
Yeah.
think that we are all made to feel that way.
Hmm.
We have these symptoms when we go in, and then they tell us, oh, you're depressed, you're
Yeah.
stressed, you're eating the wrong foods. And you feel it makes you, and because we don't talk about it a lot, right? You just feel so isolated and you feel crazy. So I think that's such an important thing is just to be validated, knowing your symptoms are real and
Hmm.
you don't have to feel
Yes.
this way.
It is
I will
true
tell you.
because,
Yeah.
yeah, you would leave there. I would leave there thinking, how did I get here? How did I get to where I am now? Like, obviously, I don't know what's wrong with me. Like, you know what I mean? You're
Yes.
like, obviously, I must be wrong because I'm telling them I never felt this way before. And they were like, I'm sure you have. No,
No.
no, I'm
No.
telling you, but what happens is you see so many different ones sometimes because now you're trying to get the appointment. Your regular practitioner may not have one. So you're like, I'll just see anybody, get me. And now you have to explain. And then they're looking at you like, do
Mm.
you really feel it? And it's like, yeah, this is new.
Yeah.
No, it's, yeah.
And a lot of times I felt like people thought I was like pill seeking. And I'm like,
Yeah.
I'm not pill seeking. I'm just telling you that I do not feel like myself. Like these panic attacks that
Yes.
are coming out of nowhere and I'm freaking out. Like I don't even know, like Beetlejuice. Like this is not normal. This is not my
Yeah.
baseline. Like I'm telling you,
Yeah.
this is not where I've not
Yeah.
gone 50 years freaking out like this. They would have committed me, believe me.
Right. And it's like, yeah, we're not crazy. And it's like, but yeah, I mean, that should be, I'm glad that is a slide. And I'm sure a lot of
Me
people
too.
appreciate it. Women, especially, appreciated that because it is also like letting you know, yeah,
Yeah.
this is
Yeah.
something that you're feeling. And you don't know what to compare it with. You have a stomach ache. You're like, oh man, last time I got food poisoning, it felt
Yeah.
just like this. And that's
Yes.
it. You get these symptoms, you're like, "Oh, the last time I went through menopause? Never."
Never.
So,
No.
what this is new.
Now, when you feel off, you start thinking, okay, what is it? Did I not exercise enough? Have I not had enough omegas? Okay, what did I do? Did I miss a
Protein.
vitamin? Yeah, how much protein did I have? All right, where am I at in my, like, do I need to change a patch? You at
Yes.
least have things that you can
Yeah.
identify that could be the impetus of what is wrong.
Yeah. Yeah. We're being our own case study, and we're figuring it
Yes,
out. We're
yes.
like,
But you have
"Okay."
tools in your toolbox at least, Like when I first started out, I had no tools. And I tell you that 15-minute visit, even though it was just like, hi, yeah, no, bye. Okay, here's a prescription, off you go. Like that to me was like my life vest. I was like, oh, okay, there's a reason. I'm not just going out of my mind.
Yeah.
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 Yeah, no,
No,
I
I
mean, it's
remember just like being so like, oh my God, I can't. Like I just would look around and it's like everything just felt like it was closing in on me. So I feel so happy to hear that there are resources coming online for women.
Mhm.
oh, absolutely. And I think just and for them to be accessible, right? Like I think it's just
Yes.
is so important and, high quality, evidence based. I think all those things are really important. And that's, I think one of the nice things about being Planned Parenthood, the program is called Poppy because we really want to differentiate it in the sense that, we know that a lot of women who are accessing it don't need Planned Parenthood's traditional services, but it's Poppy powered by Planned Parenthood Marmonte. And so
Nice.
the goal is really to kind of lean into the experiences that maybe most of us had as young adults of using Planned Parenthood where we have nowhere else to go, and
Mhm.
knowing that it's a trusted source of medical care. And so, like now, you're in this new phase of life, and you can trust us again, um, just under a different name.
And it's kind of cool, the name itself too. It's
Mhm.
like it just saying it, you're like, "Poppy Care," it's like makes you sound happy. You think of the little flower, you're like, "Okay." I don't know, it's just it
Yeah.
is all
No, I love it. I just bought a new phone case that it has poppies all over it because I'm just like so into it. It's great.
yeah.
I love it. So I have to ask, was this Poppy Care your brainchild, or was this kind of like a collective of the board?
The the concept of Poppy Care was mine. I have an amazing
Nice.
team that I kind of sort of supervise. They're all high level senior directors and VPs, but I kind of give vision, and certainly they all had their input in making it come to life. But the idea of it was really just like I said, that's and that's really my work, is to be strategic and
Yeah.
respond to what's happening in the external environment. And
Yeah.
then Poppy, we went around and around with names, and
Yeah.
we really landed on a flower or like a fragrance, or something like that, that is feminine but not like too much. And
Yeah.
then when
That's
Poppy
the
came
hard part.
out, we're like, oh, this is perfect. And then our amazing graphic designer designed the website with the drawing of the poppy, and I fell in love with it, and I was like, this is it, let's do it.
Yeah. Yeah.
I absolutely love it. I think that's so cool. And I love that you give your team credit too, because a lot of
Mhm.
people are like, oh no, that was mine.
Yeah.
Mhm.
No.
I
Yeah.
mean, I often say, like, I might have the idea or I might have the veto, but like the actual work, like all the work of setting up the technology, staffing, training our providers, all my team did all that. I didn't do any of that. I just give input, oversee it, but no, my
Yeah.
team is amazing and they do all the really hard work.
Well, that's perfect. Thank you. I'm so glad that you
Same.
did have this, yeah, idea because I mean, that's what it takes. It always takes someone that has the idea. And then
Hmm.
you're like, okay, this is the idea. Now I'm going to have people help that
Mhm.
can get this into fruition. So that's, yeah, that's the best.
Yeah. So it started in November. So have you seen an influx of people coming through? I know you did like a soft launch, but is it starting to finally grow in popularity? Because I would love just nothing more than to see this take off.
Correct. Yeah, I agree.
Yes, absolutely. So it's we did an exclusive with the Wall Street Journal of all of our new services. So we had Poppy and
Nice.
aesthetics and IV hydration. And so we couldn't advertise before the exclusive came out. And then of course, and we've had tons of media. Of course, most of the media is on aesthetics, even though my team is like, what about Poppy? Like, can we focus on Poppy? So
Right.
certainly in some of the articles, there's a mention of our program. And so we've seen an influx since then. But really, we just finalized the website. And so now we're going to go forward with more intensive
Hmm.
advertising and marketing. And so we should see a significant influx after that. But yeah, we definitely have seen growth since we started in November.
That's that's awesome. I think that's amazing.
Yeah, totally. What are some of the things that Poppy Care does do? I know that we've talked about labs, and I know you can kind of do like the questionnaire online, but are there other services outside of that that you can get through Poppy Care, like I can't even think of the word. Thank you, brain fog. You do it a mammogram. I was going to just start doing charades.
No, it's totally. I love it. I have the same problem. I'm always sitting in meetings like, what is the word for that?
Uh-huh. Yeah.
So
Yeah.
really specific to the menopause treatment. So you pay the $250 and that gets you a prescription, a year supply of whether it's hormone replacement therapy or, other non-hormonal therapies that maybe are ideal for that person. We also do microdosing GLP-1s. So we
Oh,
really
okay.
think that microdosing GLP-1s will significantly help people who are experiencing perimenopause and menopausal symptoms. And we liked microdosing because you don't get all the side effects and you can go
Hmm.
off of it. So it's obviously not a requirement, but we offer that as part of it too. And then patients have complimentary texting with our providers. So, if a week later you're like, oh, I can't remember how to do this, or you know what, I'm starting to feel better,
Yeah.
but I need a slightly higher dose, you
Hmm.
just message the provider and then they help you. And so you don't have to like pay or call in or anything. You just message the provider. So like that's kind of the realm for that. Most of the patients we're seeing right now, like I was saying, kind of have established healthcare providers. So they're accessing mammograms and cervical cancer screening
Right.
through Oregon providers. But certainly if a patient needed those services, then we absolutely could do that. It would likely be routed through the health center so they could get all the necessary things. And at our health center, for a lot of our patients who come into the health centers, they either qualify for Medicaid or they qualify for FPACT, which is a family planning program in California. And so it covers preventive care, cervical cancer screening, breast cancer screening, contraception, all those types of things. So patients can also access services that way. And then in Nevada, or if somebody doesn't qualify for those services, we have a sliding fee schedule. So certainly if somebody calls us and, they're happy to be helped with the perimenopause or menopause and they have other things going on, we certainly can help them at our health centers too.
That's amazing. I mean, it is one-stop shopping,
Hmm.
basically. Like,
Totally. I was just like thinking the
yeah.
same thing. Like, man, you guys have thought of everything.
Do you guys do anything with infertility or anything like that, or like consulting or
That's a good
Absolutely. We
question.
do we do kind of like what I say is like the first level infertility. So we do the initial workup for both the male partner and then the female partner. And then we can start Clomid, which is one of like the first line medications
Mhm.
to help with ovulation. And then once a patient starts getting beyond that point and they need, more complex
Right.
care, then we'll refer them off to a specialist. But that kind of initial work we definitely do, and getting a lot of that
It's
workup done is really
Yeah,
important.
it is
And
important, yeah.
and accessibility, right? Because we know that infertility care is really not accessible.
No.
Maybe it's changing in California. There's new laws that are being passed, but right now it's really just not accessible, especially in Nevada. And so we do a lot of that initial work to help patients.
Well, and it's so expensive when you do
Mhm.
infertility care. I think that that's the big put off for everybody. They're like, oh my God, I can't even imagine it. So to get started with
Mhm.
Planned Parenthood would be
Yep.
amazing because you're kind of offsetting some of that cost
Yeah.
and maybe identifying the root cause or part of the issue. And
Right.
then you can go forward to like utilizing your insurance benefits on something else. I mean, I don't know, but I think that would be cool.
No, no, it's great. And a lot of women do great on Clomid and get pregnant on
Yep.
Clomid. Right? And so if that saves them having to go to an infertility specialist, like that's excellent, right?
Yep.
Yeah,
That
I'm just hearing like benefits aren't being utilized as much. I'm hearing less from, for corporations that are going to have to spend on benefits. Like this is a really like huge advertising piece for Planned
Yep.
Parenthood, I think.
Exactly, because it is literally from, like, the start of menses until
Mhm.
the end, and everything in between, and I had no you don't I don't know, like, I had never even thought of it, but now I really need that number, Laura, to get Pennsylvania on that list. I don't know how much I can say.
I'll
Don't
just
worry, Laura. I will make sure she doesn't call 600 times a day.
Well, if you promise to tell all of your friends in Pennsylvania, I will get my team on it.
I
The
do,
Pennsylvania Life will
I told
start.
them because just the
Yeah.
fact that, like, a lot of times, I'm paying, like I said, monthly for something that's not needed. I already have the testosterone, but I still have to pay it. And lucky I can. And I know some friends can't do that. So now they're, it's like, where do they go? And, all you have are these other online services that there is always a fee. So
Mhm.
it's like if you can be like, oh, hey, Planned Parenthood, they have this, and it would be amazing. Like, I think that would help women really know that the one place that they can continue to go to is Planned Parenthood.
Right. Right. And
That
thank
to
you.
me.
Yeah, thank you for saying that because that's how I
Yeah.
want women to feel is that
Yep.
we're here for you,
Mhm.
regardless of what's going on, right?
Right.
Like
Yeah.
your life circumstances may have changed, and so you don't need us for XYZ, but we're still here for you.
Yeah.
Yeah.
Absolutely. And I think, the thing with your testosterone is so frustrating to me is I imagine you feel a lot better on testosterone.
Oh my gosh, I do.
Right. And
I do.
so what what
I'm super
what are we
jealous. I don't have
doing?
testosterone yet because my provider doesn't allow testosterone prescribing yet.
Yeah. I mean, it's crazy, and
Yeah.
I keep on saying to the big argument that I had, not an argument, discussion, I will say, with my
It was probably an
provider.
argument.
My provider, it was that, if I was diabetic, would you refuse to give me insulin? And, they were like, well, no. Okay, well, I was born with testosterone. There's that. And they were like,
Yeah.
yeah, but, and I'm like, but what? But what?
But what?
So it, I just, yes, I, I think it's amazing what you're doing. I will continue to tell people whatever state we're at. I mean, on the podcast when this gets out, I mean, we're in a lot of different cities, a lot of different states. So I am sure I am telling every woman out there to just go and just be an advocate for yourself and, you
Yes.
know, choose Planned Parenthood because they've always been there. No judgment or anything, wherever you are in life, no judgment on their part. So
And
that's what
all
you have
they've
to do.
done is hormones and
Yeah.
Right.
reproductive health for, I mean, how long has Planned Parenthood been in existence? I mean,
Oh,
years.
Yeah.
almost, yeah, yes, years, getting close to 200 years, right? Yes,
Yeah.
and that's right, and that's, I mean, that's what we do, right? We
Yep.
understand how hormones do different things in your body and how
Yep.
to use them, and we're also just not, I think one of the issues with why there's only 5% of women using hormone replacement therapy is because providers are just scared and nervous and they don't
Hmm.
understand it, right? And so we had, obviously the black box warning, we had that study that wasn't good. And, I went through medical training during that time when, right, like that's how I was trained is like, okay, you
Right.
can have the smallest amount of hormone for the shortest amount of time, like this, like very like fear, right? And I
Yes.
think that we're seeing that with providers with testosterone too, and certainly should we do more studies on testosterone for women in menopause? Yes, of course. Like we should do more studies on a lot of things, but that doesn't mean you can't have an informed decision with a patient
Yep.
about, you know, is your quality of life so impacted that it's worth trying this medication and seeing how you do.
Mm-mm.
Right.
Right.
And so I just, yeah, I just think it's so what we do and, we're the experts, and so until the rest
Yeah.
of, medicine catches up, you come to Planned Parenthood and
Exactly. I mean, that's a bumper sticker that I
I
would
was going to say that's a really good slogan right there. But it's
and
true. I mean, over 200 years of hormones, and that's really the only thing that you guys have really kind of dealt with. I mean, my gosh, that's 200 years of data, that's 200 years of
yeah.
like understanding a woman's body. And not that I'm poo-pooing men and not that I don't want them to get care or Viagra or whatever they need. I just think like we just have to have a little bit of space in the room. And I think if I went into a provider and they were like acknowledging me and acknowledging the things that I'm saying, I would just feel better with just
Yeah.
that, like that's a
Exactly.
starting point for me.
Hmm.
Mm-hmm.
no, and
Yeah, I
and
agree.
that's why that part is so important to me because, especially going through the cancer diagnosis and treatment, I've spent a lot of
Yeah.
time in doctor's offices when I normally would not because I don't like going to the doctor. And they all know I'm a physician, and yet they still treat me the same way, like, not validating, very dismissive.
Interesting.
I'm sure you have that symptom. Or, I'll say, like, I'm not sleeping on
Mhm.
tamoxifen. And then my oncologist will say, well, you weren't sleeping before the tamoxifen. And I'm like, well, does that make it okay? Right. And so, like,
Yeah.
I get it too,
Uh-huh.
and that's why it's so important to me that the services that I'm responsible for overseeing, that we don't do that to women, that, making the patient the center of every visit is number one, right? That's what that's the most
Yeah.
important thing.
That's an interesting
It
perspective
is.
too, that you're a physician and you're getting kind of the same, like,
Yes.
you're okay, off you go. You know what
It's
I mean?
demoralizing. I mean, it
A
truly
little
is
bit. It
demoralizing. I mean, I used to work and at another hospital, and they would always be like, "Hey, whatever the parents say." It was a children's hospital, and they would whatever the parents say. They're the expert for their kid. No questions asked. Like you say that your kid's acting weird,
Mhm.
they're going to do every test, right? So we go in there, we are our own experts. You are your own expert.
Yes.
And you can say,
Yeah.
I'm not doing well with this chemo. I'm not sleeping well. You're with you 24/7. And to
You
have
are with
somebody
you.
be like, no, I
Right.
would be like,
I
"Hmm,
know. I've said things like, "Have you lived in this body? Do you understand what it's like to live in this body? Like, I'm the one suffering here. I'm the one
Right.
going through this, like,
yeah,
physically, me." And they're
yeah,
like, "Mhm, yeah, okay, well, have a good day." And I'm like,
yeah, yeah.
"What?"
It's demoralizing. And I hope that everything in your journey is going well and as
I do
best that
too.
it
Thank you.
can
Thank you.
for that because I think yeah, women, we need to basically, and when it's another woman telling you that, it's even more demoralizing for me. But I think that women if we would stop and just help each other straighten our crowns instead of like
Yes.
pushing it
Mhm.
off or saying she don't deserve a crown, or you don't know. Walk in that woman's shoes and
Right.
then you can tell me how
Right.
you should feel. So I
Absolutely.
yeah,
I love that. Can I use it?
you sure
Oh,
can.
yes.
You got to
Oh,
put the Jersey flair in it though.
I'll practice. No, that's great. I mean, because I feel like people try to say that and it doesn't, it's like, I don't know, becomes very cliche, but I love that so much that, if we all just supported each other and
Yeah.
listened
Yes.
and said, yeah, me too.
Yes.
Yeah. And when
I
you
mean,
when you support people, like, actually mean it, you know what I mean? Because I've had so many people that are like, "Oh," but then they're off and you could just tell that they're not genuine and you could
yeah.
tell that they're not really listening, and so then you don't keep talking even though you have
Mhm.
about 8 hours worth of things that you need to say. But when you feel that they're just not genuine and, like, hearing you, you just shut down even further. So
Yeah.
I do appreciate that. Like, let's just listen and really mean it.
Mhm.
Yeah. And I'm sure based on just this, episode that we have and just getting a sense, I am sure that you treat this Poppy Care as like it is your, baby.
Yeah.
Like, and you
Mhm.
want women to feel heard. And that to me is like one woman understands, you would think, but sometimes not. But I know you do. You're the
Yeah.
woman that wants to help other women. So that to me is the most inspiring thing,
Same.
that there's women out there, girls that are out there trying to help, trying to support, and trying to make you feel seen. So that I thank you for, truly.
Thank you. Thank you. I appreciate
Same.
that.
And we will, yes, we will. Well, again, Pennsylvania. So I'm going to keep saying. And
I'm
so
in
you
Nevada,
can,
so I'm safe. You don't hear anything from
whatever.
the peanut gallery over here.
Whatever, Raquel, whatever. Here on the East Coast. And and you can be found, just so everybody knows, it's at poppycare.org, and everybody has to go to it. I mean,
Check it
truly.
out. Yes.
Yes. Thank you. And I'm going to get started on Pennsylvania right now.
Okay, thank you. I feel so good. Thank you. And I just wanted to say, to everyone out there, if you enjoyed this, please continue to follow us on Spotify, YouTube, and Apple Podcasts, because that is how we're going to get it out there, Laura.
Yes.
And on
Yes.
Instagram. And thank you to our affiliates of Good Day Chocolate, Pantry Products, Isogenics, Small Picks, and Parlor Games. So these are all affiliates that we have tried and true, and we know that they are beneficial for everything. So
Yes. Yes.
we can't thank you enough.
No, and we'll have to
Thank
get
you.
an update. We'll have to get you back so we can get an update because as soon as Pennsylvania's online or
Yes.
sooner.
After
Because I
Pennsylvania's
really would love to
online.
kind of continue to like update people on like the
Yeah.
progress and how to like how this is working because this is such a huge topic for people and so needed. So
Yeah,
needed.
I
I would
think
love
definite
to.
an update would be, yeah, we'll plan like a few months from now, and that would
Yeah,
be
Yeah.
perfect.
Sounds great. I would love
I
to.
love it.
Yeah.
Well, cool. Well, thank you. And as we always like to always end, Raquel, we will have everybody that we will see you
Next
next Tuesday.
Tuesday.